Max Parmar, I'm Director of the Medical Research Council Clinical Trials Unit. The projects that I've been involved in are the ones to try and explain and describe clinical trials and the need for evidence-based medicine to school children. I thought it was an important thing to get involved in the process of trying to get this information across to school children, and also get them involved in discussion and debate about the need for evidence and the need for clinical trials. And I thought it'd be fun. It was an interesting process. It all started with a number of us giving presentations to the playwright on work that we did, and she took that away and developed a script. We commented on the script both for information, fact, and also for the messages it was trying to get across, and also trying to encourage discussion and debate through the script rather than trying to preach. And my sense was that did occur. The interesting thing about clinical trials is that they are the area of science in which experimentation is done on humans, but with their consent. And probably there are very few other areas of science like that, so it's really quite different. It involves the general public. So we had to get that message across, that it was experimentation, but why there was a need for it, both at the society level, but also for individuals. It's quite a challenge to do that, and as I say, quite fun. I quite enjoy that, the idea of mixing with people with different perspectives, different points of view, and different approaches to addressing a problem. I think that's important because it helps you consider why you think what you're thinking, and it helps you challenge what you think as well. It was quite a good group to bring together. I think it was even more successful when we got the audience involved in participation, because they asked the questions that perhaps you've forgotten to ask. The play that was developed was very powerful, both in terms of the emotional pull that it had on people, but also in terms of the issues that it raised. I think the emotions were important because it engages people, and it was about individuals rather than just issues. But those issues were sort of drawn into individuals' lives. In terms of the effect, I'd like to think it had a very good effect. The performances that I went to and the discussion afterwards were sort of quite stimulating and very sort of encouraging in the sorts of issues people raised. It doesn't necessarily mean to say that everybody is persuaded that clinical trials and evidence and an evidence base is key, but at least they know the issues, and they know that it's not straightforward, and that, for example, doctors do not know everything. Science can't answer all questions, and we need to find ways of addressing how we improve outcomes for patients with major diseases. I'd also like to think that Starfish was successful. I think one of my slight regrets with Starfish is that we never got into a position where we were able to evaluate Starfish as an intervention itself, because that's what it is. You're trying to intervene in people's lives with this play to get them thinking about evidence-based medicine and clinical trials. We never sort of formally assessed that. We did a little bit, but we perhaps could have done more, and that's a slight regret, I think, in terms of the whole process. The first is because the public are going to be involved in those trials at some stage. If it's not them, it'll be their mothers, their fathers, their sisters, their brothers. They will be approached about clinical trials at some stage, and it's much better that they have heard about some of the issues and thought about some of the issues before they're approached about being involved in a trial. I also think that we need a public debate to ensure that the sorts of trials that we do are aimed at the good health of the public. So, for example, we're addressing questions that patients and the public want us to address, and not just, for example, questions that the pharmaceutical company need to address to get their treatments licensed and to make money from their treatments. There's an intrinsic component to clinical trials, which I've mentioned already, to do with the fact that doctors do not know everything, and they are uncertain in many instances about the best way of treating an individual with a disease. It's better to acknowledge that up front and have an open and honest discussion about that, rather than pretend actually that all things can be treated, and when you turn up to a doctor they will always know the answer to a particular question. It's just unrealistic to expect that. That's a hard one, I think, for people to deal with when they've got a disease, especially if it's a major and serious disease. Much better if that discussion and debate is held in a less emotional time and in a broader forum as well. As I said before, I think the idea of setting a play to sort of highlight some of the issues, highlight some of the both the scientific problems, but also the individual, how that affects individuals, and how it impacts on day-to-day life and how you might be treated. I think that was really key, because the play engaged people, but it also raised a number of those issues. Then the discussion afterwards helped people bring to the fore any issues that they have. I think it was particularly important that school children were engaged, because they will be the adults and the society for the future. And the more that they engage in this sort of discussion, the more they understand, the more they can make informed choices about how they want to see society framed, and how what they see is the role of evidence and particularly clinical trials in both the society as a whole, but also should they ever be approached. And of course they will know individuals themselves who have been ill in hospital. We all know somebody who's had cancer, for example, or heart disease. Either the mother, the father, the grandmother, the grandfather. And so presenting these medical problems to them, I don't think is a surprise for them. And presenting it in a way of a play, I think, was fairly effective. There may be other ways of doing it, of course. I think there'll be a number of issues that we'll have to address in the future. There'll be much more genetic testing. There'll be use of stem cells. There'll be issues around what sort of questions should we address in clinical trials. When do we decide we have enough evidence that a therapy is effective? What do we do in those situations where therapies are incredibly expensive but benefit just a few people? How do we manage our healthcare budget such that we make the maximum use of it, but also are fair in terms of who gets treatment and who doesn't? And how do we ensure that we provide the evidence required to make those decisions in the future? And the future sorts of studies we do may be quite different, as I say, in terms of the sorts of therapies we use and also the information we use, which will be a challenge both for the health service and science and medicine in general, but also in terms of what patients learn about themselves what that means in terms of both their disease, their treatment, but also their broader life. So there'll be big challenges ahead. In some ways that's a good thing, because we're progressing science and we have an opportunity to do better in numbers of diseases, but it will raise its numerous challenges. I think it's a great idea to try and engage with the public, particularly school children, on difficult issues, and to engage with them both at the intellectual and the emotional level, and to make it fun.